When we think about cancer, we realize it's really a team diagnosis. When I talk to my patients think of the team as the doctor and the nurse. But in reality, there's many more experts on the care team. And so when we think about that, we think about the patient, we think about the caregiver, the person who's actually taking care of the patient, as well as a variety of other people who can make the patient's life better. When a patient goes through cancer, they're going to be going through perhaps treatment, perhaps they'll have surgery or chemotherapy or radiation therapy. But the journey is going to involve a lot more than just the treatment that they face. It's going to involve how does the patient feel about their diagnosis? Are they stressed? Do they have anxiety? And what can we do as a team to make the patient's experience better? So when I tell my patients that cancer is actually a team disease, then they ask me, well, doctor, what else can I do? I know that you're giving me the care, but what else can I do to make myself tolerate this treatment better? And that gets us into a discussion of what is complementary and integrative medicine. Because a lot of people don't understand what that is. Some of my patients, in fact, come in and say, well, I've heard about alternative medicine. And I think it's very important to make the distinction. The distinction is complementary is that in addition to, as opposed to alternative, which means in lieu of. And that's a very important distinction because mainstream medicine welcomes additional practitioners on the care journey. We know that the patient's going to have a difficult time perhaps with treatment. We might want to include some therapies that might decrease stress or decrease pain or help the patient tolerate their treatment better. That is what we call complementary medicine. And I caution my patients about alternative medicine. Alternative medicine means in place of. Alternative medicine, if a patient pursues that first, that can delay mainstream care. That can perhaps cause problems down the line. And so I tell patients, you want to do everything possible to complement the medical care that you're getting. And so that gets us into a very much whole person approach. So integrative medicine really is the application of those skills, those techniques, and those practices that can make the patient's quality of life better. And that's what I tell my cancer patients, that I will do everything I can as a physician, but I want to expand the care team because I want my patient to tolerate their treatment the best that they possibly can. And so that gets us into a lot of very interesting therapies that patients have to be educated on. For example, what is acupuncture? Acupuncture has been around for centuries. And it's the practice where patients are getting these little needles that are placed in different points around their body. And through that process, they can achieve less pain, they can achieve stress relief, and they can achieve a sense of well-being. And it's very important when we think of complementary medicine to understand that these therapies we're speaking of have to be evidence-based. Well, what does that mean? Well, when a patient comes in to me and says, doctor, I've been diagnosed with cancer. I want you to give me the very best treatment you can. They are relying on me to get the best science, the best evidence that I can give them to try to cure their cancer. Well, we expect the same of our complementary medicine therapies. We want to use evidence-based therapies that we know are going to help the patient and that we know are not going to cause undue side effects and perhaps are not going to interfere with the other treatments that that patient is having. For example, a patient comes in and tells me, I want to take this herbal supplement. I assume it's fine, doctor, because it's an herb. And I say, never assume that. I said, we have to be very careful to make sure that whatever additional treatment you want to do does not counteract the medical care that you're receiving. And those of us who think of cancer as a team diagnosis, we're very comfortable with this. We do this all day long. We have multiple people on the team and multiple resources which you are going to hear about in these videos. And it's really important that the patient take advantage of the resources to empower themselves. Currently, we teach the medical students in our medical school, it's about patient-centered care. That means we want to look at the patient as an entire individual, and we want to think about as if the cancer is one part of a wheel. There's all these different spokes that lead to hopefully getting a cure, or perhaps if we can't cure the patient, improvement for that patient. That's what it's all about. What can we do as a team to make the quality of the patient's life the best that it possibly can be?